So we're going to take a look at the probe. The probe is used for several things, but the primary reason we use a probe as a dental hygienist is to measure periodontal pockets. This particular probe is the Marquis probe, and the uncolored portion is 3 millimeters. Then we have the black band, which is another 3. So up to the top of that black band would be 6 millimeters. Then we have another 3 millimeters, and then another black band. So altogether, this would be 12 millimeters if it went all the way to the bottom of the second black band. We also have this other probe that is marked in millimeters. So we have 1, 2, 3 millimeters. The bottom is 4 of that little black band, and the top is 5. I'm going to use the Marquis. To use the probe, we are going to start at the line angle away from our fulcrum, and we're going to always be lined up on the tooth so that this is pointing to the long axis. So we start here. We have to be careful to keep our probe so that it has some space between us and the tooth, because if we are too close to the tooth, subgingivally what's going to happen is we're going to have some poking going on to the sulcus, and it will cause tissue trauma. We want it to always stay on the tooth. If we stay on the tooth at all times, it will never be uncomfortable to our patients if their tissue is reasonably healthy. So we're going to our starting point again is this distal line angle of this particular tooth, and we're going to make very small overlapping strokes. We call this the walking stroke or a bobbing type of stroke. And we need to be small so that if there is a small narrow pocket, we will find it. We pay attention as we're moving our probe to how deep it is going, and we always choose the deepest measurement when we are dividing this tooth out. So we will have a measurement starting at the distal line angle all the way to the proximal area. So as we move distally here, and we get to the area that's just below the contact, we need to do what we call a fan, which means we're lifting it away a bit. It's angled. If we don't do that, if we're too straight, we will cause some tissue trauma, and we will not get exactly to the coal. So as we move to this area, we run into the contact point. You're going to lift it, and you're going to tip it just a little bit, and then you're going to go in again and find out what that reading is under the contact area. You never want to keep this instrument in the pocket while you're trying to tip it into that coal area, because if you do, you could cause some tissue trauma. So you want to lift it out after you run into the contact area. You lift out and then tip it a little bit, and then you will not cause tissue trauma. Once we have that reading, we're going to lift it out, start back again at this line angle, and you can see how I'm lifted away from the tooth. If I'm too close to the tooth, I'm going to cause tissue trauma. I need to be about this much. I don't want to be this much, that's too much, but I do have to be lifted away. So I'm going to make these small little overlapping walking strokes, light as a feather. And as I get here to this line angle, I have to lay my hand down a bit, because if I don't, I will not be able to maintain that fanning effect that we want to have. So you can see how at this angle right here, my probe is very fanned away from the tooth. So I just keep going, and I run into the contact area. I'm going to lift up and tip it just a teeny bit. We don't have to tip too much on an anterior tooth because it's pretty thin. Again, we're going to make sure what was our measurement. There should have been a deepest measurement here, a deepest measurement from this line angle to this line angle, which is the facial, and another measurement from this line angle into the proximal area. So the facial is going to have 3 measurements: the distal, the facial, and the mesial.